FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Carrie Lutz, and today is May 1st, 2020. Well, obviously, lots going on as always, and we want to cover what's relevant. And right now, what effect is COVID-19 having on the populace at large, and particularly on the nurses, doctors, and medical staff who have to deal with it? Everyone in the hospital has to deal with it, from the guy pushing the broom, pushing around the beds and cleaning up to the doctor. It's taken a psychological toll, and we're thrilled to have with us Dr. Carole Lieberman, and AKA the terrorist therapist. And Dr. Lieberman, thanks for being on with us again.
Well, thank you.
Hey, so when we're looking at what's happening here and where this is heading, what do you see for the psyche of the nation as a whole? And then on the people who are actually on the front lines, the first responders treating this?
Well, the psyche of the nation as a whole is really getting battered. Each day that we are in lockdown, it is taking a significant psychological toll. And that is the thing that has been missing since day one from all of the advice and laws, rules that we're supposed to follow, like be good little rats and stay in our holes. No one has been really concentrating or focusing on the impact this is having psychologically and what to do about it. I have been trying to help people understand that it's not about focusing on how many feet you have to stay away or how long the virus lives. I mean, we've been getting all kinds of different information about that, which is part of what is driving us crazy. You know, there's a phenomenon, gaslighting, where if you want to drive somebody crazy, you tell them one thing one day and then you change it and you give them contradictory views of what something is until people finally go crazy. And this is like a major gaslighting experiment. And it is affecting people's lives. People are getting anxious and depressed and committing suicide, which I call covicide, committing suicide out of fear or out of desperation related to coronavirus. And still, we're not, hearing about that. I mean, isolation and loneliness itself has, long before coronavirus, been studied and shown to have, just in itself, devastating physical and psychological effects. And then you add to that all of the paranoia that the media is promoting. We're all going to die is the message, and you really have a stew, to, as if it were an experiment to make people crazy.
I could not agree with you more. Luckily, I've got a dog and my son is in the house, and I do walk around, but I really miss most going to the gym, seeing my friends at Starbucks in the morning where we'd have a little roundtable session and talk, and all of those fun things in life. My work is still the same. I work from home, talk to people, interesting people like yourself, but the social life is non-existent now.
And we do need social life. That is something that is wired into us from the very earliest days that we were human. We needed to depend upon other humans in the wild environment that we originally began in, with different predators, animals, and so on that could kill us, and for food and everything else. And so it's wired into us that we need to be social. Now, of course, we can and we should be calling people every day, Zooming with people or Skyping with people every day. But, I'm sure you've been hearing about the Zoom fatigue. I mean, that was fun at the beginning. Now it's just getting to be enough already. It's not like a unique, fun thing to be doing. And it's not as good as being with people in person.
It definitely isn't. Look, I've been using Skype, Zoom, any number of audio, video platforms on the computer for many, many years. And so for me, Zooming or whatever is just not where it's at. I get little social gratification from it, really. Something about being with somebody else, getting their energy, giving your energy that you just cannot do over the phone or even through a video teleconference. And really, none of this has been taken into account of the number of strokes that happen, heart attacks from people who are socially isolated and alienated, I might add, because it really is alienation that you're going through out there. And the effects of that, it's a case of the cure being far, far worse than the actual underlying disease, which is pretty bad in itself, but which is not that extraordinary.
Yes, absolutely. I mean, something visual like Zoom and Skype are good for checking on someone, to be able to see their face, like to see how healthy they look, or, whether they're really depressed and you need to try to help them to get in contact with a hotline or something. But we need physical touch. We need hugs. We need, we need handshakes. And of course, Fauci, who I feel has done the most harm to our country. He's been talking about how even after we are allowed out of our holes, that we shouldn't be shaking hands, like we should never shake hands again. I mean, this is bad, bad stuff. We need, there were studies that showed that we need 4 hugs a day just to survive, and 8 hugs a day to kind of maintain at a good level, and 12 hugs a day to thrive. So we can't keep wearing masks and gloves and not shaking hands. And I mean, that is going to have an even greater, like a chronic effect on our society.
Yeah, I couldn't agree with you more. I think this guy has done more harm than the entire Soviet Union during the Cold War. They were never able to shut the country down, and they were never able to inflict such strong personal distress and damage. And everything about it appears to me to be the wrong way to go about this. You're an MD. When did you ever hear of a quarantine where they locked away the healthy people to protect and then in New York State, what do? The most vulnerable people in nursing homes, long care facilities, they send the COVID-19 patients back to the nursing homes to infect the other people there and cause major hundreds, maybe thousands of deaths that way. And what is this thing all about? If you're not protecting the most vulnerable, then who are you really protecting at all?
Yes, it's hard to not see some kind of an overarching plan to kill the elderly. I mean, that's how they have been treating this. There isn't really, in the typical kind of assisted living or even senior living in apartments and so on, all those kinds of places, they aren't set up to deal with COVID. Even hospitals, are having trouble saving people with COVID. Other than, the ones who are severely ill, and so sending people with COVID back to nursing homes. How can you not think that this is an intentional plan to get rid of the elderly so that we don't have to pay for their, not only for coronavirus, to help them get over COVID or coronavirus, but just in the future to not have to pay for their medical bills.
New York State has one of the most generous Medicaid benefits out there. Medicaid in New York State pays for nursing homes, and they've been trying to get a handle on it for years, and sending people back there, it's really, if it's not murder, it's gross negligence of a scale that not even not even politicians have been guilty of in the past. I mean, this is the most shocking thing, that you could send patients back to nursing homes when you know they're infected and then hide behind privacy laws that say, well, you can't ask in the nursing home whether or not this person is infected. You just have to take them back, and nobody has protective clothing. There's no ability to contain it and mitigate it, so it spreads like wildfire. And then what do? They blame the nursing home. I mean, this is a catch-22 of biblical proportions, not to mention you kill off a bunch of the nursing home's clients, and the nursing home is no longer viable.
FSN Radio. It's all about what's next.
Lumina Gold, ticker symbol LUM on the Toronto Venture and LMGDF on the OTC, is yet another of legendary mining investor Ross Beaty's Lumina Group. It's advancing the largest primary gold deposit in Ecuador. The resource is estimated to contain 16.7 million ounces of gold and 2.2 billion pounds of copper. At just $7 US per ounce gold equivalent, it trades at an incredible 13% of its net present value. More good news is on the way with an updated PEA study expected in Q2 of 2020. It has unparalleled infrastructure. There's grid power to camp with plentiful, inexpensive hydropower available. It's close to 2 ports and is just 8 kilometers from a paved highway. Water is plentiful. It's at low elevation, and the closest community, which is very supportive of Lumina's effort, is just a 7-kilometer ride. With all this going for it, it's likely to follow the typical Ross Beaty formula, which means big returns to shareholders. Find out more and sign up for notifications at luminagold.com. That's Lumina, Lumina gold.com.
The Financial Survival Network. It's all about what's next.
And also the nursing home staff. And there have been staff either getting sick or not wanting to come into the nursing home to work. I mean, there are going to be lawsuits after this, suing nursing homes, suing the state, families, the children of these elderly people who are in the nursing homes. I will be very shocked if there aren't a whole bunch of lawsuits in regard to
rightfully there should be, but I can tell you from past experience, 90% of the people that sue the state wind up getting nada. It's a very difficult barrier or mountain to traverse when you're suing the government, but it should be done, and hopefully it will be done. So let's talk about these people, the caregivers, the first responders, the people on the front lines. We're talking the doctors, the nurses, the techs, all of these people. I know somebody who's on the board of Mount Sinai Hospital in New York. And obviously it's peaked and it's really dramatically falling off now. But at its worst, the people there wouldn't go home because they didn't want to infect their families. And I think in Mount Sinai, they probably had adequate equipment, but it was a tremendous stress on the system. And it's a credit to these people, the doctors, the nurses, all these people, the administrators as well, that the system didn't collapse and come crashing down.
Yes, it has been enormously stressful for doctors and nurses and other medical professionals because there is so much more than that they are having to deal with. Not only do they have to deal with this onslaught of patients all at once, but they also have to worry about getting sick themselves or getting as you said, their family members sick, their colleagues sick. And a lot of them are winding up treating their colleagues, which is something that they don't usually have to do. It is plus, I did my psychiatry at Bellevue in New York, and I did before that, I did a year and a half of rotating sub-internship, and I did a year of medicine at the New York Infirmary. So I'm very familiar with what it's like to work in ICU and work in the ER. And even before COVID, there are times when, you don't get very much sleep, and there are times you're up all night and so on, especially dealing with ICU in the emergency room. And now, with unprecedented numbers of patients and some who are very, very sick, it's just a greater strain than anyone could have ever imagined. And so So and plus, in some places, there weren't enough personal protective equipment. And so that's another part of it for why they're, would be or should be more concerned about getting sick themselves. But doctors and nurses aren't really, that's not, if they go into, people who go into this field aren't really thinking of themselves for the most part. They're there to serve. And, in some ways it's exciting because you want to help more people. There are so many people sick, but, at a very quickly, it got to be overwhelming. Not just, I have a lot of people I can help. It got to be just overwhelming. And, there is a number of doctors and nurses. There is a number who are committing suicide. There was one just recently, a Dr. Lorna Breen, who actually got COVID herself and stayed home for a week and a half, and then she came back. She wanted to help her colleagues, deal with all these patients, and then they sent her home again. And then not because of COVID, but I think because, I guess they didn't know if she was still infectious or whatever. And in any case, she went home to her family in Virginia, and she ended up committing suicide for all these different reasons that we're talking about, all the stress. And I think also because they didn't allow her to come back, I think that might well have been the straw that broke the camel's back, that she really wanted to help so much and wasn't allowed to. So it is especially stressful for them.
Well, your heart's got to go out, and your prayers to people who caught in this whipsaw. Getting back to the thing with New York, it put a lot of pressure on the system, but they barely used the U.S. naval ship that was there with all the medical techs. Yeah. I think they had 40 or 60 patients there at the peak, and there was a provisional hospital set up in the Javits Center. They didn't really use that. And there was one in Central Park. So a lot of the panic over the disease turned out to be unfounded. And hopefully we should learn something from that for the future.
Well, yes, absolutely. I mean, I was saying from the beginning about the coronavirus stress syndrome, talking about how we were overreacting. But, that actually boggles my mind, what you were just mentioning about why some hospitals were allowed to get, for example, this Dr. Breen, she was talking about, and she was connected to Columbia, a hospital connected to Columbia. And she was talking about how people were dying and that the ambulances couldn't get to the emergency room. There were so many patients, and some of them were dying in the ambulance because they couldn't get help quickly enough and so on. I don't really understand why some hospitals in New York were so overflowing, and these other places that could have provided more, calmer care were not utilized.
Yeah, it's mind-boggling. At the very least, it's a major management issue of management competence or lack thereof, and then you could get into the more nefarious things. Well, Columbia Presbyterian Hospital, I know it well, right by the George Washington Bridge in Manhattan, serves a poorer population in Harlem, yes, and in Washington Heights, and all through, poorer parts of Manhattan. It's probably the best hospital available in that section of Manhattan, and yet they're overwhelmed when they could have been taking them down to the ship, to the Javits Center, to Central Park, but incompetence. One thing you can always count on for incompetence is that New York City, New York State always have an overabundance of it in supply. And I think that's probably more what it was than anything else, because they were getting paid by by the federal government for these patients, guaranteed income, whereas all their other income had been shut off by the reaction. So God only knows how many other people were really wound up with much poorer health outcomes because they didn't get there fast enough. Potential cancer patients, et cetera, who've been literally locked out of the hospital for the past 2 months.
Yes, that's a whole other death toll that we haven't even begun to count. And I don't know if you know, but doctors are, when a patient dies, doctors are being instructed to write on the death certificate that the person died from COVID,
Correct.
even if they had a heart attack or some other kind of death-inducing situation. If they happen to be also positive for COVID, they're told to say that this was a COVID death, which of course is inflating the numbers.
It's fraud.
And then to go back to what we were talking about with the elderly, I mean, that does seem to make the same sense in regard to these poor sections of New York or any place where is this not a coincidence? Is this somebody's nefarious plan? The people who use up money more in society to get rid of them.
The deal was, I heard, and I haven't been able to verify it, but I've heard it from some health care professionals, that if the person is diagnosed as having died with COVID-19, the hospital automatically gets $15,000. And if they needed a ventilator, if they were put on a ventilator, then they get $35,000. Now, I don't know if that's true, but it certainly wouldn't surprise you, would it?
No, absolutely not.
Yeah. So when we look at this, what do you think we've learned from all this, Doctor?
Well, for one thing, I think we should learn that we need to have plans in place, more reasonable plans in place for the future, and that for whatever may happen in the future. This is a perfect example of a terror attack. This could be putting the question aside as to whether it is a bioweapon from China, we could talk about that. But even just not, let's just say some other kind of terror attack, whether it's a bioweapon or a bomb or whatever. We do have to have better plans for how to take care of large number of patients. And plus, we need some education of politicians and even doctors who aren't psychiatrists, like Dr. Fauci, need to have better education in terms of the psychological impact of all of this.
Yeah, I could not agree with you more. It's disgraceful. A lot of things have happened. I don't care how impeccable your program, your planning is, preparation for this, unless you've gone through it at least once or twice, like they have in Korea and in Japan and in the Far East. Unless you've gone through it, you can't really be prepared for this. Really hard to be prepared. So the important thing is that now we've been through it. What are we going to learn from it? And how are we going to be better prepared for the next time if it's even worse, or if it is a bioweapon? And I hope that they're thinking about these issues in D.C. and in the state's capitals, because it very well could happen. Once it happens once, it could easily happen again. Well, Doctor, if we want to find out more about you and connect with you on the web, where do you go to find out about you?
Well, my basic website is drcarole.com, which is drcarole.com. And then my terrorist therapist website is terroristtherapist.com.
All right. And there's a link to them in the show notes to this interview on Financial Survival Network. Questions, comments for myself or the good doctor? Email us, kl@kerrylutz.com, kl@kerrylutz.com. Twitter feed @KerryLutz. Facebook page is Financial Survival Network. And of course, the main site, financialsurvivalnetwork.com. Doctor, thanks so much for being with us. We appreciate your input and your insight, and we wish you the best.
Thank you. You too.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.